This session is going to be on how we collect network data. We're not going to talk specifically about IRB issues today because we're going to talk about that in depth tomorrow, but I'm more than happy to answer questions if they pop up and they seem pertinent, so that sounds great. Theoretically, I always start this work with Peter Blau, and I think the diversity of responses to why people are studying networks makes his point that much more clear, which is that to speak of social life is to speak of the association between people. They're associating in work and in war, in love and in worship, to play, to help or to hinder. It is in the social relations been established that their lives become realized, right? This is what Blau might refer to as the strong program in social network analysis, right? What it means to be a person, right, as opposed to a human critter, right, is to associate with others. And when he was in a joking mood, he would say the difference between a gourmand and a glutton is company, right? And so this is what it means, right, to be a human critter. To be the kind of person that is a person means you have a father, you have a mother, you have a friend, you have a neighbor. It's the roles we inhabit socially that make us unique and interesting. And it's that what shapes our identity and helps us understand, right, who we are in the social setting that we're engaged in. And social networks is a way of attacking that and understanding it. And this was Jacob Moreno's original insight into the social network analysis field. So Jacob Moreno said if we ever get to the point of charting a whole city or a whole nation, we would have a picture of vast structure, like a vast structure of intangible structures, powerfully influencing conduct as gravitation does in space. Such an invisible structure underlies society and has its influence in determining the conduct of society as a whole. Right, this is the promise of social network analysis, right? Just like physicists have gravity and like laws of motion that allow us to predict the orbiting of the planets for the next billion years, right? If we'd only understand this invisible force that's connecting people to each other, we might be able to do something more to understand, right, how the social movements that people are engaged in and how they interact with each other. Now, that might be a little bit oversold, right? And Jacob Moreno is known to be essentially insane, so it's not entirely clear that we want to take him completely seriously, but we think there's something there, right? That there is this idea that if we can understand these networks, we can do it better about understanding the world. For those of you that care about network visualization, this is actually a 5x8, a 3-color hand-drawn sociogram that's put together by graduate research assistants that was working with him at the time. So next time you think that your RA job sucks, right, you could have been doing this. So this is an idea that people have been playing with for a while now, and it's really taken off. So if you were to do a search for papers on social networks and health, you see this rapid growth that took off in the mid-90s, and it's been going off pretty dramatically ever since. Now about 4 or 5%, or about 4% of papers by the end of 2010 were on networks and health. How does that compare to something else? Well, this is the number of papers on obesity and health, right? So this is actually a pretty substantial body of literature, and it's growing dramatically. And we'll go over this literature in more depth towards the end of this week. This is also something that NIH and NSF are both investing a lot of money in, right? This is why NICHD decided to fund this workshop, because they realize that people are studying this and are finding it important, but aren't getting training in it. So what we want to do is help ourselves understand it. And that's sort of the intellectual background to why we're doing this work. Now, what is a network? Why do we care about it? Right, so when I think about a network, or when I think about a school, for example, you might think about a building or a curriculum or teachers or something like this. But when social network researchers think about schools, this is what we think of. Right? So this is a high school to a social network researcher. This is one of the ad health schools, and you're going to see a lot of these diagrams. So just briefly, X and Y don't matter so much. I could flip it, I could twist it, I could rotate it. What matters is proximity. So in this particular network, what you find is that there's a clear distinction between this upper left and this lower right, and there seems to be some distinction between the right and the left as well. And so you end up with these 4 big clusters with those sort of weak connections between. And this tends to be organized by the kinds of things in social space that we think would organize a school. So in this case, we see that the 7th and 8th graders are on these groups, and then the 9th graders and the seniors down here in yellow. So there's an age grading on the one side. In this case, there's also a race grading, right? So in this school, you have white kids and black kids that aren't necessarily talking to each other, or that is, the extent to which they're friends with each other are about as equivalent to the extent to which the junior high kids are friends with the high school kids, which, since these are separate physical buildings, is just not that much, right? So this is the kind of setting where if you were to go into the lunchroom or into this school, even though it's integrated at the school level, it's segregated at the relationship level. And this is the kind of thing that we think we can spend some time understanding if we know what these social networks look like. So this is the insight behind it, and yet most of our standard sociological methods and social science methods have not been attuned to this set of problems. And this is a quote that Alan Barton put up in 1968, that for the last 30 years, empirical social research has been dominated by the sample survey, which is a sociological meat grinder, right? And we all know this in a much more formal sense. So what's the first assumption of all statistical analysis models? Your cases are independent, right? The whole point of being able to assume that your errors cancel out to zero is that the cases are independent, that we don't have autocorrelation or some other kind of structuring to the errors that would create a problem. And what the network approach is really about is saying that that kind of connection, that thing that links one set to another, is the thing that's actually important. And so by assuming away the connections between our cases, we've actually thrown away the piece that we care about, that it is informative to what makes social life social. And so what social network analysis is attempting to do is to provide a set of tools to allow us to retain some of the generalizability and modeling approaches that we're used to with classic econometric methods, but bring back in this connectivity between cases as opposed to throw it away or try to assume it away as error. And so in that case, then, the big, broad picture is that social network analysis is a set of relational methods for systematically understanding social life, and it's motivated by the structural intuition that actors are linked to each other, they're part of a social space, and they're connected or near or far or something like this. It's grounded in systematic empirical data that draws heavily on graphical imagery. That is, that we have this sense that if we can make the invisible visible, that actually helps us provide insights in ways that we might not otherwise see. And it draws heavily on mathematical and or computational tools. All of this seems pretty straightforward, right? This is kind of the basic foundation of why, if you didn't sort of silly suspect this, you probably wouldn't be in the room. The key is that a lot of these elements are never taught anywhere, right? We don't get these kind of tools, and a lot of the kind of techniques and tools are elements that we don't do a lot of in our standard sort of ANOVA testing or experimental designs or what have you. So, how do we think about this network analysis problem? If that's our vision, that we care about understanding social structure and the way in which cases are connected to each other, how do we go about modeling that and making sense of it? There are a couple of different ways to do it. One is to think about networks as variables. That is, we can imagine mapping this structure, distilling it down to some characteristic that we attach to an individual, and then use that characteristic to predict an outcome. So if I care about how centrality or popularity predicts drinking, or whether or not isolated people are more likely to vote Republican than unisolated people, or what have you, in that case, then that would be sort of a classic network as variables approach. That's a weak side of networks, if you will. I mean, at that point, what I've done is I've taken my mindset from independent cases and sample surveys and said that the same thing that way I would treat education or knowledge about a quiz, right, is the same way I would treat centrality. It's good, it's a better than nothing, and it's actually quite powerful often, but it's not the entirety of a network approach. The more deep approach is to think about networks as structures themselves, and what we're trying to do is come up with succinct descriptions of those structural properties. Right? So is this setting more hierarchically organized than this setting? Is one setting more relationally segregated than another? Why or why not? What drives that process? If I drop a disease into this population, is it going to fizzle out or is it going to take off and spread? Right? Why would that happen in one case and not in the other? How do the changes in disease patterns in a population reshape the network? Right? So these are questions about the structural arrangements of the outcomes. It turns out that there's another way of thinking about this, which is the distinction between what I like to think of between a connectionist approach and a positional approach. A connectionist approach is the thing we're used to thinking about. In a connectionist approach, I'm going to fill this out. In a connectionist approach, we really treat networks as pipes. And what matters is that there's something in the network that's flowing through the network, and that's what we're trying to track. So it might be disease, it might be information, it might be understanding, right? So what happens is that the network finds a spot at one point in the network, so one person gets the idea, they pass it to their friends, you pass it to their friends, and so forth. This is probably our most intuitive idea of why networks matter. It's a classic process that comes out of something like disease diffusion, or telephone, or 6 degrees of separation, or any of these sort of stories that you're used to thinking about. That's mainly about a networks as pipes issues. If we're thinking about that as a cause, and that diffusion is doing something like causing a disease or creating peer influence, it's a classic element of social capital that my network has something, I can follow that link out and get that resource from them and use it to make my life better. If it's a result, then we're asking a question about social integration, peer selection, right, homophily, right, that we end up being the process going on through these pipes in the network make the nodes similar to each other. It's a classic element of homophily, for example. On the other hand, we might be cared about a little less common way of thinking about networks is what I refer to as positional. And in the positional case, networks are roles, and patterns of relations define a way of being and acting that are unique to that position. And the most common way that we're used to thinking about this is in formal hierarchies, right? So a vice president is a frustrated position everywhere in the world. It doesn't matter what company you're in, and it's not that vice presidents of lots of different companies are connected to each other and bitch and complain about how powerless they are. It's the fact that they're powerless by virtue of their position in the structure that makes vice president a bad position to be in, right? Unless you're Dick Cheney, and he just flipped it. But the idea is that there's something unique about the pattern of ties, and that unique pattern defines a set of opportunities and constraints with respect to other people in the setting, which shapes the way in which you behave. Right? The most common way we understand this is a role. And the reason you can think of something like a cop versus a robber, that's a position. Like all robbers run from cops, not because they've been learned from other robbers that they should run. It's not a connectionist idea, it's that they were trying to get away. Right, so that's a silly example, but same thing with cousins. Right? The reason that cousins are very much similar to brothers than they are to uncles is because of their structural similarity in the kinship network. So let's go through these a little bit. The classic connectionist idea comes from diffusion and disease. The epidemiologists in the room know this equation very well. This is the classic reproductive rate idea. And the idea is that the extent to which a disease is going to be more or less likely to spread, if this is greater than 1, is a function of these 3 features, right? It's a function of the contact probability, so it depends on the probability that a contact will be infected over the duration of contact, that's beta, the likelihood of contact, which is C, and the duration of infectiousness, which is D. Now, if you have a random disease that flows easily in a population, where you can essentially assume that contact is random, then this becomes a rate. So this is the likelihood that one person with the flu sneezes in a room of other people with the flu. If you have something like HIV, which is hard to pass and requires a very intimate contact, then C becomes a thing that is difficult to model as something as simple as a random connectivity. And so what network analysis becomes in that sense is visually fleshing out what this contact probability is. And to make that a little more concrete, imagine that I was trying to model an STD in a population. And so my research design was to follow the standard sort of social science model, and I go out and I collect data on who's had sex with who, or how many sexual partners people have had in a while. These would be the representations of people who have had 2 sexual partners. So each of my sample nodes in red have had 2 sexual partners in the last period of time, but they're isolated. They're sending out, they're sort of spread out over the rest of this, over this space. What really predicts their disease potential is their position within the overall network of sexual contact. Right? Now, these are real data. These are data from high school students collected as part of the Ad Health project. And where some of these people who have 2 partners are isolated and not connected to any others, some of these people who have 2 partners are connected to 287 other people in the network where they could get a disease. This is my favorite graph to show high school kids. Because, in fact, out of a school of about 400 kids, almost 300 of them are linked in a single connected component, right? Now, there's a lot of issues about whether or not a real disease can move through this network. Right? There's timing issues, there's infectability issues, and so forth. But the key thing is that we intuitively think that something like your number of partners is going to be your best predictor of disease. But in fact, the number of partners is a pretty poor predictor of disease. And the reason it's a poor predictor of disease is because lots of these people out here that are connected to everyone else have only 1 tie, but they're connected to people who have more than 1 ties, or connected to people who have more than 1 ties, and so forth. Whereas other people who have multiple partners are often in an isolated corner somewhere. And so this notion of being able to distinguish a volume effect, a local point of contact effect, from a structural effect is really the network's type insight. That what matters is not so much how many ties you have, but how those ties are situated in a pattern of other ties with the rest of the population. To think a little bit more systematically about how this kind of thing might matter, imagine you were to play this volume game right across the entire population. And you can imagine a world where we have everyone in the network has a very small number of ties. Right? Most people have 1 or 2 ties, a few people have 3 ties. In that kind of world, if ties were distributed essentially at random, you'd get lots of little disconnected components. But what's interesting is that if you increase the number of ties people have just a little bit, to go from mostly 1s and 2s to mostly 2s, to mostly 2s to a lot more 2s, right? You can move a distinction between have a completely disconnected world to a fully connected world. And what's interesting about this is this kind of a movement, right, from almost no connectivity to complete connectivity occurs over a range that you probably couldn't sample within your variance, right? It's a very small difference between an average of 1.6, I'm sorry that's not coming out, to an average of just over 1.8, right, partners per person in the network. Now, I've picked these ranges deliberately. This is on the edge of what's known as the phase transition. that if you go from anything lower than this, you can never get a disease could move. Anything above this, you get very high connectivity. But depending on lots of different things in the networks, this really sharp transition space can be very sharp and be very hard to detect on the outcome. But knowing which side of this phase you're on is a key element to being able to understand whether a disease is going to move through that population or not. So this is the insight, the basic insight that we hope to get to in understanding our measurements from the connectionist model of disease transmission. The positional model is about roles. So imagine I present you with 5 people engaged in 3 relations. 2 of those people share romantic love, and they feed 3 people who bicker with each other. Any idea what this might be? Right? I don't have to tell you what the labels are, right? Parents feed children, and children fight with each other. Now, if I were to flip around the labels, right, if I were to put a parent label down here, we'd call the police, right? Because that's not right. It's not supposed to happen. Right, so the idea is that there's some notion of role and role obligation that goes from the pattern of ties. And that's the insight between the positional model of network analysis. That if I know the pattern of ties, I know the constraints that people are engaged in, and I know the opportunities they're engaged in, and it probably tells us something about the rules and expectations on them in their social setting, right? And so in this case, it's an easy one. We understand kinship relations and we understand kinship modeling, but in lots of settings, say like exchange of feeding or favors or something in a village, these roles might not be formal. They might be informal. Right? So you might have informal leaders, you might have informal cliques, things like this, and these positions provide a way to think about hierarchy and activities within a setting. All right, we already said that. So that's really a super quick sort of theoretical overview of sort of why we might care about networks. Questions, comments, thoughts, concerns? And I told you I talked fast, since I just can't help myself. Please.
Quickly, will we get slides?
Yes, all the slides should be on the Dropbox, so we can, if they're not there now, we can get them to you quickly. So, other questions? All right. So I'm going to leave the sort of, we're going to try to filter sort of content throughout the week, as opposed to spending the entire time on network theory, though I'd be happy to do that if people are interested. And we're going to move quickly now into some data issues and what's unique about network data, how it's organized, and how it's arranged. All right. So the classic thing that distinguishes network data from every other kind of data is essentially you have everything you care about are 2 types of data. So on the one hand, we have the nodes, and on the other hand, we have the edges. The nodes are the kind of data that you as social sciences have collected your entire lives, right? So this is a rectangular file, 1 row per person, a column that describes anything you care about them. Their age, their race, their sex, their gender, whatever it might be is a function of the nodes. That's the data set you're used to playing with. So we're not going to talk about that data set a whole lot. In addition to that, we have relations, these edges, the arcs, the lines. The jargon in social network analysis is pretty atrocious. This is because the field is developed across like 6 or 7 different fields simultaneously. And so the mathematicians refer to them as relations, or their nodes as vertices, right? So I'm going to try largely to refer to the things that connect to each other as nodes. These are usually people. They might be organizations. They can sometimes be ideas. The connections between 2 nodes are usually an edge if it's undirected, an arc if it's directed, but you might also hear relation, you might see line, you might see contact, right? So this is this part of the jargon in the field. Networks come in lots of different types of flavors. So the simplest possible network is an undirected binary network. In this case, we have a set of nodes linked by a relation which is necessarily symmetric, right? So had sex with is a relationship that if A has sex with B, B must have had sex with A. And so that relationship is both symmetric and necessarily so. Now, it might also be valued, so we could have had sex once, or we could have sex 3 times, right? And so that's a distinction. A directed relationship is one where the relationship between A and B does not necessarily imply a relationship between B and A, right? So if I nominate you as a friend, it's most likely you nominate me as a friend, but you need not, right? If I think that Jake is cool, he need not say that I'm cool. Right? And so this is the kind of a distinction between a relationship that is could be reciprocated but is also directed. Now there's a third type of relationship that we don't deal with that much in social networks amongst humans, which are anti-symmetric relations, that if I have this relationship with you, you can't have it with me, but it's a classic relation in dominance hierarchies. So if you're dealing with chimpanzees or other sorts of species that have very strict hierarchies, then a dominance of one person over the other implies necessarily a non-dominance of that person back to you. But for all the work we're going to do, we're going to focus on either undirected or directed. In the directed case, it's possible to have reciprocation, but not necessary. And again, you can have value ties, and you might represent value ties with thicker edges or something like that. By convention, the rule is always for directed ties, the arrow goes from the source to the destination. So this is a tie from A to B is given by the arrow going out of A. The beauty of an edge node distinction is that once you have a node data set, you can layer as many types of edges over it as you want. This is known as multiplexity. And so in this case, we have 3 types of relations. We have a green relation, a blue relation, and a red relation. And you can stack them over the same set of nodes, right? So this might be sought advice from and also like, right? Whereas you might have something like thinks is a jerk in green, right? So there can be lots of different types of relations that you layer over the same set of nodes. And in fact, it's this multiplex features of a relationship that really ties people into their role sets. It's not just that I share romantic love with somebody, it's that I share romantic love with this person and also feed this person that distinguishes a parent from a mistress, right? I'm going to blank. Hopefully that's not. Oh, okay, so the idea is that the different type of relationships that you have define your identity because of the intersection of the different types of relations simultaneously. Right? Now, once you get these basic elements of nodes and edges down, we have to think about levels of analyses. And there's a wide range of levels of analyses. The most basic distinction is between an ego network and everything else. So an ego network or a local network is where you have data on a single respondent and their direct contacts. Right? Now this ego or local level network could be just sampled and reported from the individual. So I've sampled somebody, I said, tell me who your friends are, and then tell me about your friends. That's a classic ego network analysis. I've only sampled a single person. I've never talked to the other people. On the other hand, it might be that I sample one person and I snowball out to those people and interview them, right? But the key element of an ego network is that it's focusing on a single focal individual and their direct relations. Now, once you move past that, you can have partial networks, which might be a snowball design or an RDS design, which doesn't collect the entire network of interest. So not everybody who could ever be exposed to an STD in a country, but a subsample of them that you've sampled out for some set. And there's lots of different ways of getting this. In reality, the vast majority of our sociometric data are partial networks, and they're constrained by missing data. We only have as much as we might want. On the other hand, there's this notion or this idea of a global or a complete network, where you have all relations amongst some population of interest. And in this case, you've defined the population ahead of time. You've identified whether or not there's relationships amongst all possible pairs of people within that set. And this is why we can refer to it as a complete or global network data. This is really easy when you have a strong boundary on the network, right? So if I want to know co-voting amongst Supreme Court justices, right? The beauty of it is there's only, how many of them are there now? We have 9? 9, yeah. All right, so we have 9 of them, and so I know all relations that could exist between them. It's on the record, it's there. I don't have to worry about some missing justice that just happens to pop in and out from time to time. Whereas if I'm dealing with kids, right, it might be that school is the relevant boundary. And I know that what I really want to know is all relationships among kids in this high school. But 10% of the kids on any given school are going to be absent on any given day, and so I'm not going to actually have complete data in that order. But we're going to act as if. Graphically, we can think about the distinction between these elements as different levels of analysis on the same underlying network and what part of that network are observed versus not observed. And so the classic element of most relational networks are something like a best friend dyad. And there's been reams of studies published within developmental psychology and other relational sort of fields about the single relation. Right? This could be an adolescent and their best friend. It could be a husband and wife and social support, right? Where the unit of analysis is some primary dyad, and the key focus is what's going on within that dyad. We extend out a little bit. We can get an ego network, right? So the individual focal person, their best friend dyad or their key relational dyad, and a bunch of other people that matter to them. A slightly different distinction is something that you might refer to as a primary group or a community or a peer group, right? And so I might have a group of people that I hang out with most often, right? But I might have some friends outside of that group. Right? So these are the people that are all members of the sociology department. We're good friends. We all talk together all the time. But there are a few economists that I deign to talk to from time to time. All right. That's a joke for the economists in the room. You don't have to laugh at my jokes, but it lets me know you're awake. So, now, an ego network is usually defined or as a single person, as a focal individual, and the one step out, but you can define an ego network for any distance you want. So I can have a one-step ego network, a two-step ego network, a k-step ego network, right? It's just essentially how much information and time you want to go to what gather. Please.
Same thing as like a star to star, like 2 stars versus 1 star.
You're thinking of this from an ergom standpoint? No, not quite. You're on the right track. But hold that idea. The idea between 1 star and 2 stars is really just in degree and out degree. It's not necessarily defining the whole network. So I know there's a hand in the back somewhere. Is there a question? No, okay. All right, great. So the partial network is usually achieved by snowballing out from some set of focal nodes and then enumerating all relations amongst the set that you've snowballed out from. And so if I start here, I get the friends here, I ask this person who their friends are, they might reciprocate and nominate the person I nominated or I sampled already, but they might also bring in new people into the survey. And you can just keep snowballing out as far as you want to go. A key feature of a snowballs type sample is that you can never get isolated pairs or dyads out in the outside because you only reach them through a chain of relations. And so any kind of snowball sampling method systematically underrepresents isolates and the socially isolated by virtue of the sample design. Now, sometimes there's nothing you can do about that, right? But it's something you want to just keep in mind when you're collecting your data. And so finally, one of the advantages then of a global network design is that if you first enumerated the entire set of nodes, you can ask who are your friends, and they might say nobody, right? So you can end up getting isolates in the population. Questions on levels of analysis? Going once, going twice. Please.
Are we going to talk about creating boundaries at all? Or like beyond this? In terms for
I don't remember. But now this is a perfect time to talk about it. So there are essentially 2 ways of thinking about boundaries. I think I am going to cover this. Let me make sure. I usually do. Yeah. Yeah. So we'll come back to boundaries in a bit. Just planning your back ahead. The thing that us sort of arrogant social network types like to point out as the key advantage of network analysis is that you're getting this interdependence, this rich embeddedness in social life. The Achilles heel of global network analysis is that you need the population, right? And so it really is a census design. And so the trade-off between a deep social network model and the independence assumption and the rest of statistics tends to be sampling. And that can really be, that's not a cheap trade-off. So this boundary question is actually an important one to keep in mind. It turns out that we have some new tools that allow us to bridge that boundary and bridge that distinction some, but it's a tough one to bridge. So if you think then about, so what do we have thus far? We have types of data elements within a network. We have nodes versus edges. And we have levels of analysis. We have whether or not you're at the local level, the partial level, or the global level. We also have what are known as modes of network data. And so network data that can exist in 1 mode, 2 mode, 3 mode, K node. What do I mean by this? A 1 mode network means that there's no distinction, no necessary separation amongst the nodes in the network. Right? So it's possible, logically, to have a tie between any pair of nodes in the network. So a friendship network is a 1 mode network. There's nobody in the school that I can't definitionally not be friends with. Right, and so if you would imagine the set of people that I could name as a friend, then every one of those people in the network is possible to be named as a friend. In a 2 mode network, on the other hand, there's some distinction between one class of nodes and another class of nodes, which makes it impossible to have a relationship within that class. Right? The classic example is authors and papers. Right? So some of my nodes might be authors, some of my nodes might be papers, and authors can write with each other through papers, but I don't actually author another author. Right? I write a paper, you might write a paper with me, and so we jointly author the same paper, and that would create a connection through us indirectly through our authorship of the paper. Similarly, you can imagine that people connected to meetings, you can have words used by people. These are multiple sets of ideas where there's a distinction between them. A classic example that we bump into is heterosexual sex. Right? So by definition, if you're looking at heterosexual sex, you have one class of nodes males, another class of nodes females, and there's no relationships within the set. All the relationships are between sets. Now, the beauty of two-mode or bipartite network data is these data are everywhere. Right? This is the single best source you have for collecting network data cheaply, right? Because you've already collected it almost in any kind of survey you've asked. If you've asked people what church they belong to, if you've asked them what committees they've gone to, what papers they've published, like huge numbers of archival data allow this to agree. Right, so this is one of the most classic data sets out there. It's the Davis data collected in the 1940s, where you have 18 women who attended different lunch parties together. Right? And so we saw that Flora went to lunch number 11, and so did Helen and Nora. Right? And the thing about these kinds of data is that it allows you to identify connections between people because they share some event. Right? So these are indirect connections. That's not a question. Just move this in. Once you have these indirect connections, this is known as a bipartite network. Right? So in this case, there's always going to be an open triad between E1, a person, and E2, for example. But you can flip this around, and you can say, well, now let's turn what we call the one-mode projection of the two-mode data. So we can project data through the modes. And so I can ask, how are people connected to each other by the number of events they've shared? Or I can ask, which events share people? And this is a really nice way to identify network constructions in places where you don't expect to see networks. Right? In fact, in the kind of places where it'd be really hard to collect networks. So for example, imagine you were provost of the university and you wanted to know whether or not you had an integrated university or a disintegrated university. Well, if you were interested, you could go and look at every PhD committee that any faculty member at Duke sat on, and you can create the committee of all PhD of faculty connected by shared students. And that's what this is for Duke. Right? So if you look at Duke University and you map each faculty member who's ever served as a faculty member on a dissertation committee, you can identify the connections between those faculties, and you find that, in fact, the university is connected. It's one giant connected component, but it's very clumpy, and it's clumpy by discipline. So the natural sciences are deeply integrated. Right? The social sciences are fairly integrated, and the humanities are really clumpy, right? With one exception at Duke, which is philosophy. Anybody know why philosophy at Duke is sort of in the middle of everywhere else? Because at Duke, the main philosophical specialty is philosophy of science. So a lot of these philosophers are sitting on natural science and social science committees. That's something a little unique about Duke. But a university like Duke that has this kind of integration is going to be different than a different kind of university. So you can imagine thinking about interdisciplinarity at a university as the integration of social relations across these data. Now, if there are something like a couple thousand, I don't remember, the end is being cut off here, a couple thousand faculty members here, if I had to do this as a survey, it'd be exceedingly expensive. Right? But I can get this archival from a university record in a matter of moments. That's me. For those of us that care about health, right, we can ask about, this is a project we're doing with David Dwin over at UNC, looking at antibiotic-resistant infections and transfers across hospitals. So this is the one-mode projection of hospitals and critical care facilities connected by shared patients. And this is patients that overlap in the same setting, all of whom have an antibiotic resistance infection. And we can time the overlap. So we can say there's a link between two people if they were at the same place at the same time. And again, to get this, we don't have to say who coughed on you at the hospital. We don't have to survey them. We don't have to talk to them. We just have to look at their chart and say, where were you when? And from that, we can connect the potential underlying network that might be driving disease in this kind of setting. Or you can ask how physicians sharing patients create hidden communities in hospitals and how those hidden communities affect hospital performance. We use Medicaid data in this case to look at physicians across a wide range. We started with 5 different states. But just for this particular paper, we went through and looked in each hospital. We identified the number of physician communities in that hospital and then compared the readmission rates for the two communities in each hospital. And you find in some communities they did exactly the same. In other communities, you'd have a very low performing and a very high performing, right? Now, the key is if you were a hospital administrator, you might like to know whether or not you have one group of physicians who refer patients to each other who are not doing very well and another who are doing very well, because you're being held responsible for the performance of the entire hospital, not from one performance or the other. And most of the time, these are hidden, both the patients and administrators, but they're there under the hood in the pattern of shared data. So this is the only reason I'm harping on this a little bit is that a lot of people think that the only way to get sociometric data is to do a census survey, and that's exceedingly expensive and time-consuming, and it can annoy the bejesus out of your population. So don't do it unless you have to, and don't ignore the kind of data that are probably already sitting on your hard drive somewhere or very easily accessible to you, which can allow you a lot of network insights with a lot less data collection work. Questions, comments, thoughts? Please.
Isn't there a smaller number of cases for the two-mode network analysis that you need to have? Like if you have hospitals, how many hospitals do you need to have in a study in order to have a good study?
Yeah, so how many hospitals? The question was how many, so the question is how many, what's the end would you need to have a good study? Yeah, so for two-mode networks. The beauty is there's how do I say this? There's no minimum n, right? It's always substantively defined by the problem at hand. Right? So if my interest is in tracking disease that moves through, say, a county or something, then I would want all hospitals in that county, or at least the majority of them. If my interest is in trying to infer to the connections between different types of ambulatory care institutions, say private versus public, then I can do that with a random sample. All right? And I could do it with a random sample of people and project to the categories of hospitals. So it turns out that one of the nice things about two-mode networks is that they are sampleable in a way that one-mode networks are not. And so that's also a nice feature of them. Now, ideally, what you would have is the population of whatever mode you care most about, you would have a very high proportion of that sample. So if my interest is in the integration amongst faculty at a university, then hopefully I have the majority of faculty records for what survey or what committees they served on. If my interest is in understanding the hospitals that are most at risk to passing on an infectious, an antibiotic-resistant infection, then I hope that I have a pretty good representation of all the hospitals in that setting. At least the ones that are most likely to be central, so the biggest ones in that case. The beauty is, for something like transmissions between hospitals, I don't need the universe of patients. I just need the universe of hospitals, right? And so I can have a random sample of patients so long as that random sample of patients is going to generate enough cases to give me a representative sample of the edges amongst the hospitals. Does that make sense? Now, one of the things that, especially those of you that are used to sitting on biomedical review sections, there's no equivalent of a power analysis, right, in network analysis. And so if you have a biostatistician on your team and you're doing a network analysis and they say, well, I don't know, do you have enough power to identify this effect? The answer is, I don't know, right? And the reason for this is because of the assumption that you have the population. If you have the population, there's no statistical power inference that needs to be made, and so there's now no power calculation to be made because you have definitionally the census, so there's no inference question to be made. That said, most of the time, right, you are going to want to know whether, so what it ends up doing is it changes the inference question from do I have enough of a population to infer to the people I didn't sample to do I have a process that's different than I'd expect to random. And so there are some questions you can ask about statistical significance and these kinds of things, but they're not inference to the population in the same way. They're an inference to a hypothetical event space. But we're going to get more into that when we get to, I think it's day 3, where we go over randomization and inference and these kinds of things. Great questions, though. More? Thoughts? All right. So these are we've now talked about the sort of basic background, the types of data that you might collect, nodes and edges, different layers, different modes, given some examples where you might find these kinds of nodes. How do we now then represent these data, manage these data, and organize them if we actually want to do some work with this? The traditional way of representing a social network is known as an adjacency matrix. So an adjacency matrix is simply a two-dimensional array. So you have all the nodes down the rows, all the nodes across the column, and the ith j entry of the row column entry of that matrix records the pattern of relations between them. So in this case, if A nominates B, we have a tie between A and B. We put it in the 1-2 cell. Because this is an undirected binary network, everything above the diagonal is mirrored below the diagonal. So a tie from A to B also means a tie from B to A. So if your network is directed, then this matrix is just not symmetric. That's the only difference. One thing that we usually do, both in directed and undirected, is the diagonal is usually set to 0 definitionally. Because I hope you love yourself, but I'm not going to record it, right? So it's just something I don't put in the matrix. If you have a valued network, the adjacency matrix is simply a valued adjacency matrix, right? So if I have a Likert scale about how much I like you, A might like B at value 1, and B likes A a lot, right? And so you can have a value tie between that, and that's perfectly reasonable. And what else to say about this? There we go. Now, an adjacency matrix, the only problem with an adjacency matrix, how to say this, you're going to see a lot of adjacency matrix notation in the mathematical parts of the course, right? Because the beauty of an adjacency matrix is we can leverage everything about matrix algebra to talk about social life. So we can take the transpose, we can find the eigenvalues, we can do all kinds of fun things to the matrix, right? The problem with an adjacency matrix is that the number of elements in a matrix goes up with the square of the number of elements in the set, right? So this ends up being a really cumbersome way to store data. So no one in their right mind would actually store an adjacency matrix as an adjacency matrix because it's just a pain in the neck to play with. So instead, we have two other types of data storage that we typically use. The common element would be an adjacency list, where you have, just like with your classic sort of cases and variables, you have one row for each person in the network, and then one column for each type of relation they have. So my first friend, my second friend, my third friend, and so forth, right? So this is most likely how your data is going to come back if you did a survey. So if I went out and did a survey on Qualtrics or somewhere, and I asked you to name your 5 best friends, that data is going to come back to me as friend 1, friend 2, friend 3, friend 4, friend 5. Right? So I'll have each person who responded to my survey and 5 variables, and the content of that variable will be the ID of the person they nominated as a friend. The beauty of that is it's really compact, right? We know right where the data are, and it's easy to move from. There's some other issues with it. The other common way to store data is what's known as an arc list or an edge list. So in this case, I don't record anything about the nodes per se. I just record each edge. There's a tie between A and B, between B and A, between B and C, and so forth. The key distinction, the key thing you have to be careful with if you have just an edge list is, again, you don't have any way to represent isolates. So if you don't also have node information, you might lose people here, right? So if someone offers to send you an edge list, make sure that they've also sent you a node list so you know where your isolates are. If you have a value tie, right, the adjacency list format, this is where it gets a little bit cumbersome, is that I have one value that identifies the person, right? So I have friend 1 or friend 2. Then I have the value of friend 1 relation, the value of friend 2 relation. So you need to have a parallel data structure between the identity of the author and the value of that tie. And that might be true if you want to record this as, say, friendship, a coworker, other kinds of multiple relationships. You're going to have a dummy variable or some other indicator for each set across the way. An edge list is a more efficient way to collect that kind of data. So I can say there's a relationship between A and B. It's at value 1. Then I can have as many columns as I want on this edge list to characterize the attributes of that relation. So are they a coworker? Are they a friend? Are they a sex partner? This is just another column on the data set. So it's easy to maintain that. Questions, comments, thoughts on this? Now, one of the nice things about R, it's a bug or a feature, I think it's supposed to be a feature, is that this is all under the hood. Right? You'll never see it. Right? So once you get a network object, right, there's a way in which it's stored in R, and these attributes are attached to each other, and you don't have to look at them in order to think about them. I discourage you from taking that as the default. Right? Spend a little time thinking about them and looking at them and making sure you know what they say and why they're there, so they look the way you want them to. A two-mode network data set, the distinction there in the adjacency matrix is that they need not be square. So I have people and events, say, or authors and papers, or terms and documents. In that case, there's no requirement that the number of columns corresponds to the number of rows. And so this is a classic rectangular data set. This is why I say you probably have this data already, right? Anytime you've collected some series of attributes about people, I can link those people by the similarity across their attributes, and that becomes a one-mode projection of the two-mode graph. How do you get that? You get that by doing essentially summing the extent to which I has element k and j has element k. So if person I is in the same club that person j is in, this value goes to 1, and you sum that up for the number of times that I and j share something. Right, so this is just a very simple set. Again, the beauty of having this in a matrix format is that the way you get the one or two mode projection is you multiply the original two-mode adjacency matrix by its transpose, flip it on its side. This is that classic high school algebra trick you might have forgotten. right? So you have the net matrix like this, you flip it on its side, that's its transpose, right? So what used to be a row is now a column. What used to be a column is now a row, but the order is the same. And if you take the original network, multiply it by its transpose, you get the person-to-person network, or the original transpose. The transpose times the original will give you the group-to-group. And again, you're never going to have to do this, right? You can write your own matrix thing if you want, but all these tools are under the hood. But the key is just to remember that the goal is to figure out for every pair of people that I want to project to, how many items do they share? And this is the way you get it. Now, the nice thing about this is if you do remember your matrix algebra and all the little things that have to go with this, you can leverage all of these tools, everything you had from basic matrix algebra, to say things about connectivity among sets. So the number of cycles, the number of two-steps, the number of things like this are ways of thinking about multiplying matrices or otherwise manipulating matrices, but you don't always have to do that. All right, questions, comments, thoughts on, please.
Are we going to go about are we going to discuss how to prepare our data to use whether or not we put it into a matrix?
Jake is going to go over reading in data, correct? Yes. So most of the time your data will come in either as an edge list originally with a separate node data set, and you'll map both of those to an object in R, or your data will come as an adjacency list, a set of nodes and variables, and then you map those to the set. So both of those can happen in R.
If you're trying to layer on different types of relations and different types of ties, would you need a separate data file for show those like a matrix for friends and a matrix for...
So the question is, if you have multiple types of relations, do you need a different data structure for each type of relation? So a matrix for friends, a matrix for marriage, a matrix for sex ties, what have you. No. So if you were to store them as adjacency matrices, yes, you would need one for each one. Right, exactly. So if you have an edge list, what you would do is if I had three types of relations, who's married to who feeds who bickers with who, I could have those as three separate relationships, or I could just have person 1 to 2 feeds, marries, and bickers. Right? So that's a very unhealthy relationship between 1 and 2. Or 1 and 3, they feed them, but they don't do the others. Right? And so you can have any as many relationships as you want, just on the edges, so long as it's fine that an edge has nothing. Right? Though usually you'd only have one, otherwise why have it on the set? Does that make sense? And this is why this is from a multiplex. These are known as multiplex relations. And the beauty of storing multiplex relations is that it's a lot easier to store them in an edge list format than almost any other format. That's one of the reasons that people still use edge lists.
One of the reasons I ask is because we often use Twitter networks for some of the work that we do, and you can find relations as a follow relationship or a reply relationship. Right.
Just so people in the back could hear, the point was that something like a Twitter network, you have a follow relationship or a retweet or other kinds of things like this. And the question is, would you treat that as a separate matrix or not? Now, it does turn out that there are times when knowing the multiple matrix structure can become useful. So if I want to identify the global similarity between two people, I might decide to do this thing we call structural equivalence, where in which case then I would stack the who's married to who matrix on top of the who feeds who matrix on top of the bicker network. And then I can just say, give me the correlation between any two columns here, convert that 3-node network then into a symmetric 1-mode similarity matrix. Right? And so that then lets me say how similar are any two people with respect to all of these relations simultaneously. Now I could do that in the same way by probably doing some fancy correlation across all of these and averaging them, but it wouldn't be near as complete as that. So there are times when that becomes useful to do. Yep. My students in class stop moving after about the first week because they're afraid I'll call on them. Great. I'm going to switch gears a little bit now and start moving into move out of data, sort of the big picture of the data organization, because Jake's going to go over sort of manipulating data in R. And I'm going to move to how we ask questions and what we might want to ask and sort of the other sort of data collection side of things. Is that cool? All right, great. I got about a half hour? Great. All right, so I think that this is, of course, basic survey research 101, but I want to be, it's just in the sense of completeness. The key question, the first question always, when you're asking any kind of survey or network data, There's nothing magical about network data. The question is, what do you want to know? Right? What's your theory that's guiding the research? Because that theory that's guiding the research is going to guide what kind of questions you ask and why you might ask them. Right? And so if I have an idea that a health outcome is linked through some mechanism, that's going to describe relation. Right? So the beauty is, and this is why HIV and STD networks are so wonderful for network analysis. There, I know what the outcome is. You get a sexually transmitted disease. The mechanism is very clear, right? You have to have had sex or at least exchange a bodily fluid with someone else who also has an STD. And so the kind of questions I'm going to ask about are going to be needle sharing networks, having had unprotected sex with, and so forth, right? So in this case, with something like STD moving through a sexual network, the mechanism is perfectly clear. And because the mechanism is perfectly clear, the data collection problem is perfectly clear. I know what survey I have to ask, what survey questions I have to ask, and what information I need to be able to identify. A lot of times that's not the case, right? So in the world where we care about sort of the social behaviors in health, what we really want to think about is there are lots of different kinds of health behaviors, right, that lead to different kinds of health relevant outcomes, such as opportunities or information or norms and practices, right? And those kinds of things then lead to the different kind of diseases you might have, and thus the different kinds of metrics you're going to measure. So I'm going to get a discussion network, an admiration network, or an unsupervised interaction network. These things are all turning on a different kind of social mechanism. And so you need to think very carefully if you're in a breast cancer care referral network, what do you really care about understanding there? Do you care about whether or not people are generating trust, or do you care about whether they're trying to gain information? Those might be two different pieces. And so, so your particular setting is always going to determine exactly what you want to know. Now, in the ideal world, the way we all design our surveys is the NIH gives us an unlimited budget. We take that unlimited budget and we spend an unlimited amount of time because we don't have to worry about getting tenure, right? And so we spend that time doing formative research and developing a questionnaire and identifying the absolute perfect instrument, and then we go out and do that survey. And I expect that's what all of you are going to do. But for those of you that can't do that because you're in a hurry or you're cheap or you're from UNC or some such, in that kind of set, then you might have to do something a little more omnibus, right? And what do we typically do, because network data collection is expensive, well, all data collection is expensive, we instead try to identify a set of omnibus relationships that can cover lots of social mechanisms simultaneously. And this allows lots of people to use the data. It allows it to be consistent with testing lots of different theories, but it also necessarily makes it less crisp, right? Instead of asking, who did you have unprotected sex with, I ask, who are the 5 most important people you've talked to, right? A little bit of distance there, right, between the one mechanism and the other. And so you want to think very carefully about whether or not it's social contact, whether it's respect, whether it's information exchange. What is the social exchange that is relevant to you, and how does that social exchange then lead to a mechanism? And that kind of mechanism then is driving an outcome that you care about thinking of. Right? So it could just be co-presence, and if I'm in the presence of greatness, I aspire to the same. Right? Or it might be that the great person actually has to talk to me and may encourage me, make me feel good in order for me to do something. And so you need to be clear about what that is. So social mechanism ambiguity allows for broad use, which favors relations like contact and admiration and so forth, but it often makes this causal mechanism problem a little more difficult. All right. So if we're going to do this, then the key thing to keep in mind is you always have the mechanism is tied to the social mechanism is tied to a social relation, and that's tied to the health outcome. So whatever health outcome you're thinking of, people tend to leave out the mechanism. Right? They think I care about whether or not people have heart disease or not, or exercise or what have you. So I want to know who they're talking to. At least give yourself a moment to ask, well, what is the mechanism that links conversation to having a heart attack? What are we going to say? All right. So now, if we're going to do this process, we've decided we're going to ask a question. We're going to first have to decide what our boundary specification is. And this is an old problem. It's known as the boundary specification problem. And the point is that you can only infer to relations amongst the people you've collected data on. Right? I want to be really clear about this. Right? You can only describe relations amongst the people you've collected data on. People who are not in your survey or not in your sample, right, are definitionally not in your network. That doesn't mean they didn't have that kind of health relation that leads to that mechanism that creates the outcome. They just aren't in your sample, and you can't say anything about them. So we're going to talk a bit about missing data and the implications of missing data here in a moment. But from a designs perspective, right, when you decide to do your research design, You have to ask whether or not the people I'm collecting data on are the relevant population for the disease process I care about. Right? So in general, we typically have a couple of different ways of thinking about this, right? We have, again, the local networks or the global networks, but then now we want to add this other distinction, which I'm going to refer to, for lack of a better word, sort of a realist position and a nominalist position. And a realist position is the boundary from the actor's point of view. Right? This is the actual real risk set for whatever social mechanism you're interested in that is containing the relations of interest on your population. Right? So if what I'm really caring about is STDs among adolescents, the risk set is anybody who could be having sex with my adolescents. Right? And so it's much bigger than a school. Right? And so if I showed you that diagram before of sexual relations among high schools, I've excluded all kids outside of the high school who just weren't there to fill out my survey. And so that's the distinction between a nominalist value, which is the boundary from the researcher's point of view, and the realist boundary, which is the boundary from the disease or the social process point of view. Now, from a local standpoint, these tend to be a little bit closer, right? A little bit easier to get. So from a local standpoint, it's everyone ego is connected to in the relevant manner, and that's often easy enough to get if you're just doing a survey. So I can say, well, who have you had sex? Who are the last 3 people you had sex with? Right? That doesn't matter where they're at. It doesn't matter if they're in a school. It doesn't matter if they speak the same language. Anything, right? This is all from the local standpoint. This is one of the strong advantages of ego network data collection is that I can often tailor my survey questions to really make a very tight coupling between the nominalist boundary and the realist boundary. There are some good crafting of question issues you want to be aware of, right? So you want to ask, we'll get into that in a minute, but essentially you want to make sure that you aren't implying boundaries that your audience doesn't, that they might think something's not there. The most common one is respondents can't believe that you actually want to hear the same name twice. Right? So if you ask multiple relations, they won't tell you, I won't mention my wife as someone I confide in and someone I hang out with, because I already told you that I did things with my wife, right? And so you want to make sure that respondents know that it's okay to say the same name to multiple people, for example. Global networks tend to be a little harder in the sense that if you care about something like everyone who's a community health worker in a particular community, and the relevant people are people who are feeding patients into a community care system, these, what you would like to know is the set of all people who have ever referenced a patient to a Duke hospital, say. But in fact, what you can collect are everybody who's ever submitted a billing record to a Duke hospital, right? And those two might not be the same. So you just need to be aware of what those boundaries are and why they might exist. Now, these realist boundaries can be a little bit tricky as well. So this is one of the AdHealth schools. For those of you who don't know the AdHealth design, it was a national probability sample of schools. We sampled every high school and all the junior highs that fed into the school. So in this case, we have one high school and one junior high. And there are a small number, of ties between the junior high and the high school. Right? But for most of the kids in this setting, the junior high is irrelevant. Most of the kids in the junior high, the high school is irrelevant. So we would have probably done not too much damage to this setting if we had just picked the building as our boundary, right? And it would have saved us the money of listing these people on the roster. So you can think about how well your nominal boundary, school, catches a distinction or not. On the other hand, physicians sharing patients are an incredibly open boundary because American patients are remarkably mobile. So we have all Medicaid claims from, we sampled 1 in 4 patients, Medicare patients from Ohio. And then we found every physician they visited in that year. And so from Ohio, you reach almost every county in the United States. And so from a boundary standpoint, the physicians that are interacting in Ohio with lots of shared patients are getting inputs from physicians that they have no control from Florida, from Miami, from all over the place. Right? And so the National Physician Network is a system that is remarkably connected through patients because patients go on vacation and they stub a toe in LA or something. And so they see a physician in the emergency room who then passes on an infection that comes back to Ohio. Right? So being able to think about what the appropriate boundary is for physicians might be very different than it will be for adolescents, but you need to be aware of these kind of boundary issues. In practice, then, you probably need to set a pragmatic boundary, and this is almost always defined by your cost, right? So what's the sampling unit that I can afford to sample, and what's feasible in terms of actually being able to collect data. And then you might also want to ask, if you do have some kind of boundary system like that built because of feasibility, I strongly encourage you to ask about boundary crossing relations. So I'm only going to collect identifying information on other kids in the high school, but tell me how many friends you have outside the school. Right? At least that way I can put a control variable in the model that says that these are the effects of the peers that I'm aware of, but this kid has a lot of peers that I'm unaware of. Right? And so these kinds of things make it possible to do that. Another way to do this is that you you don't have a nominal boundary on something like school, but you only trace within a certain time. So only the last 3 sex partners as opposed to any sex partner in your life or something like that. For adaptive sampling features, such as linked trace designs, you might use a capture-recapture model to decide when you should stop sampling. So one way at getting at the realist boundary is that I keep snowballing until I stop getting new information. And so this is a nice way to be able to collect the entire population because you're letting your sample tell you what the population is. The problem is you imagine that I was doing that. What I really cared about, wrong direction, in this school was relationships among the junior high. And unbeknownst to me, I early jump over here. I can end up collecting a lot more data over here that's irrelevant to the process that I care about here because I didn't recognize some unobserved clustering feature that dropped me out of the population. So the kind of capture-recapture model is good if you know you have a pretty bounded population to start with, but you just don't know exactly where that boundary is, such as, say, drug users in a particular city or something. But if there's reasons to think that there are really highly distinctive populations, then you either want to enumerate the entire thing or make sure you understand what characteristics define those numerous sets. So this is, again, why it's really important to do, if you can afford it, as much formative research as possible to make sure that you're getting information on your bounds. All right, so a couple of things to keep in mind that might also save you a little bit of time and trouble is that the level of analysis applies different constraints on the kind of sampling you can do. So local networks are great because you can do simple random probability samples, and it's really nice. And think very carefully about what, again, what social mechanism you're interested in. If I'm interested in, say, race segregation in high schools and the extent to which racial segregation in high schools generates microaggressions and stress amongst kids, and thus a health disparity in stress response types of health outcomes for blacks versus white kids, I actually don't need a global network data. Right? All I need to know is how many friends of each kid are white versus black. Right? Because then I can infer the black-to-black connectivity within each setting from a random sample of kids. Because what I'm really doing, my real substantive question there, is about the connectivity between races, not between people. Right? And so in the case where I really care about categorical interaction, for example, an ego network is a fine instrument. It's cheap. I can do random sampling. I can do power analysis and all of this, and I don't have to do anything about confidentiality. Right? So if you have a kind of question that is really about category mixing, ego network designs are fantastic, and they're highly underused. If I really care about reciprocity and trust, right, ego network designs are great. Right? And again, it's the extent to which I need to know exactly what the other person is doing or not. Now, one of the problems with ego network is that people are remarkably poor reporters on their alters' behavior. So there was this big group of research that was done in the 60s and 70s on peer delinquency. It was done by asking kids whether or not their friends were delinquent. And lo and behold, delinquent kids think their friends are remarkably delinquent. But when you go and ask those kids what they do, they're not. And so people overestimate the similarity of their peers dramatically. And so if your question is really about peer influence, about how the behavior of an ego affects the behavior of an alter, then you really want to know from the alter what their behavior was. Now, if instead what you think is active is what I think my peers are doing is driving the behavior, then it doesn't matter that it's an overestimate, right? If I think that all of my friends are smokers and that it's okay for me to smoke, then that's okay. It's really, if you really think it's moving to that operationalization of my perception of my peers. But you want to be sure that you have a good reason of knowing that, right? So don't attribute to peer behavior what is actually a perception of peer behavior. So again, this is a question about the mechanism. Don't knock on local networks if it answers your question. It's far and away the best data to collect if you have a local network question. Adaptive sampling or which are linked tracing designs or responder-driven sampling designs require you to sample edges. Right? So in that case, you're not sampling nodes, you're sampling relations. I start with a set of seed nodes, And then from that person, I say, think of all of your friends. Ideally, give me 2 of them at random. I'm going to go find those 2, and give me 2 more at random. I'll find those 2, and so forth. And you have to ask yourself, what drives a person to give you a friend's name? And what's the underlying sampling process that's generating the snowball set? It's very unlikely to be the same as give me 2 of your random friends. And so instead, what tends to happen is people give you 2 of their best friends, or 2 of the friends they think are most dangerous. So they try to please you and try to say, well, what you really care about is people who have STDs. I'm going to give you my 2 friends that I know are sleeping around a lot, right? And so you end up with a biased sample because your respondents are doing something that they think is helpful that might not actually be. And so you want to focus your attention on the sampling of edges and the edge sampling process. And again, a complete network requires a census of relations within some given bound. If you really need complete data, if you need that full census, remember that you probably only have an N of 1, right? There's 1 school network. And this is why something like EdHealth or Prosper are so valuable, because there we have hundreds of networks. And we're getting to the point now where we have more of those, right? So we can compare one school to another. But those kinds of data sets are expensive to collect, and it's really good to be working in a team. So something like the camp data set where you have 60 different networks, right? That's gold, right? Because then you can compare network level settings on one versus one case with another. And an N of 60 might not sound like a lot if you're used to doing samples with 50,000 respondents, but 60 networks is a big sample of networks, right? And so just keep in mind what your unit of analysis is. All right, so Jake tells me I'm running out of time. We just talked about that. So the main design issues then, I think I've already said all this stuff. The main design issue to keep in mind from either a global network sample or an ego network sample is the number of alters you're going to ask questions about. And this is really a trick for how much money and time you can steal from the rest of your investigators, right? So you might tell your co-investigators that I'm going to do, I want to add an ego network module to the survey. That sounds cheap. Until you realize I'm going to ask you about 5 friends. For each of those 5 friends, I'm going to ask 10 characteristics, and then I'm going to ask you about all pairwise connections among all 5, right? So all of a sudden now you've taken what sounds like one item in the survey, and you've turned it into a 15-minute module in the survey, right? So these things can be very time-consuming, and it's important to understand what you collect. Now, there's always some limits, right? So if I ask an ego to report on the characteristics of alters, they're going to get tired of responding pretty quickly. So we typically limit the number of respondents that a person can nominate, not because it's the best thing to do from a representation of the data standpoint, but because it's the only way to get your respondents to fill out the survey just from pure fatigue, right? And so in AdHealth, in Prosper, and others, we've limited it from saying, tell me all of your friends, to tell me your 5 best friends or your 7 best friends. What that does is it truncates the tail of the distribution. Now, ideally, you pick that N, 5 or 7, something like this, in a way that is informative of the setting. So for adolescents, 6 kids can sit at a McDonald's table. There are 5 seatbelts in a car, right? So there's a lot of things about social life that make local networks relatively small. And most kids are going to have a small number of close friends. And so doing a network analysis or a network questionnaire where you ask for 5 or 7 is perfectly reasonable. If I'm thinking about something like people you've worked with on a team inside an organization, well, how big are teams generally in an organization? Do a little bit of work ahead of time and figure out if the average team size is 6 people or 60 people, and that's going to distinguish the number of questions you ask, right? In terms of asking questions on a survey, these will be in the notes. You can go back and get them later. A couple of elements about the survey. One is about informed consent, and we're going to go over said IRB in more detail on Tuesday. But one thing to keep in mind is that if you're not doing an ego network design, it has to be confidential data, not anonymous data. Right? Because you as a researcher have to link the person's name to the other person, and so you need to retain the IDs. And if you're going to do longitudinal data, then you have to retain those IDs in addition. Now, I have known people who have shipped the IDs to third parties to recode and send back, so you can promise the respondent that none of the investigators who are doing the analysis will know the respondent's names. That's fine. But at some point, the data have to be collected, which is identifiable. And so this is part of the reason why you need to make sure that that's part of your informed consent, so they know whether or not they want to give you that information and keep it or not. And this is, again, why if you don't need to do that, then don't, because you'll scare people away. People don't want to give you their friends' names. We're going to go through that in a section. There are two general types of question formats. One is a version of open recall, and the other is a checkoff or a response list. So in an open recall, I ask you to nominate your friends, and it can be 5 friends or 3 friends or whatever, but the issue is you tell me the number of names, and I just ask you to recall them. The alternative is I know ahead of a time the number of all the people in this setting, and I just give you a list of the names, and you check off, am I friends with this person or am I friends with that person? Both of these methods have trade-offs. The problem with the open recall method is that people get tired, and they tend to fill out the number of names you give them lines to fill out. So if I give them 5 lines, they'll give you 5 friends. If I give you 7 lines, they'll give you 7 friends, right? And so there tends to be a pretty strong instrument effect when you have an open recall survey set. On the other hand, when you have a checkoff path, people tend to just sort of check off the list, right? I'm friends with everybody if it's no work for me to remember anything about them. Right? Pam Paxton and I did a survey at UNC once, a number of years ago now, in a sorority, and we thought it would be good to use a checkoff format. But we were worried about this problem, and so we added Amy Willis to the list. Amy Willis didn't exist. It was the name we made up, but it sounded sort of like the names in this setting. And it turns out that a lot of people knew Amy, right? Some people said they had lunch with Amy. Thankfully, no one said that they were good friends with Amy, and no one said that they were they roomed with Amy, right? So that was helpful. And people who were in leadership positions in the sorority were more likely to say they knew Amy because they didn't dare not know her, right? And so this is the problem with the kind of a checkoff format. And so if you're going to do that format, it will tend to lead to overestimates of the relationships. So this is a trade-off, and again, it depends entirely on your setting on which one is best. There are 3 types of questions that we generally ask in network surveys. There's the name generator questions, there's a name interpreter questions, and then there's a social relations roster. And so the name generator question is the thing that's eliciting the relation of interest. And so if you have something like the General Social Survey, this is the survey question they've asked for years. From time to time, most people discuss important matters with other people. Looking back over the last 6 months, who are the people with whom you discussed matters important to you? Just tell me their first names or initials. So this is an ego network survey. Now, take just a minute, right, to answer this question for yourself. If you have a specific health mechanism in mind, discussing important matters are probably not the best question you could ask. You might want to ask, tell me who you've talked to about bronchitis, or about cancer, or about healthcare, or about a series of other more specific things. The reason the GSS uses this name generator is because they don't know if people want to use this data to study health, or to study politics, or to study race relations, or 1,000 other things. So this is a very general name generator that gets at lots of different close relations without having to be specific about any one policy or outcome domain. And that's great for the General Social Survey, which is used by thousands of social scientists around the country, but it's essentially everyone gets a little bit, and nobody gets exactly what they want. Right? And this is why some of the results in the GSS have been so hard to interpret. Then we have the name interpreter question, which I thought I had an example of here, but I don't see it. So a name interpreter question is we'd say for each person, we ask them a question about whether, I don't have it there, but we'd say, so now you told me that you were friends with Bill. Is Bill white? Is Bill black? Is Bill male? Is Bill female? So you have a series of questions that interpret the node characteristics about the person. And that can be quite, it can be as extensive as you have time for. Then we have this thing called the social relations generator. And there what you're trying to do is get ego to estimate things like the density of the social relations. So I will say, does person 1 know person 2? Does person 1 know person 3? And these can be very long because the number of cells here go up with half of the square of the number of people you've asked for. So if I ask for 5, I end up getting, what is that, 10, what people I had to ask for, but I had for 6, then I've added another 5 more questions, right? Now, the nice thing is a lot of the new data collection techniques make these things, especially online, these can be pretty quick to do. So I can say, tell me about Lisa and Randy. You know, what do they share? And I can ask you lots of different things. They just check it off. From how often do Lisa and Randy do a series of things, right? So these are questions that you can do. If you can do it on an online survey or on an iPad or something like this, they can be relatively easy for respondents to go through. They can also be tedious. So again, be really clear about how much information you want and test it. We've used designs where we ask for a lot of names up front, so we'll tell us your first your 16 best friends, but then we'll say, tell us the 3 best and then 2 other random ones that we select to do these kinds of pieces on. And this is, again, just about respondent fatigue. Any ad health users? This is the ad health instrument. So what we did in ad health is we asked, this was a school survey, and each kid in the school was given a little phone book and a paper pencil test. And the question was about all your male friends. They had to begin go write the friend's name down, look up the friend's number, bubble it in, and say some other things about it. This is a miserable instrument, right? But this was 1994, right? We didn't have laptops to hand out at the time. And so this is, it's kind of amazing we get any signal out of the amount of noise this instrument is going to give us. But to think very carefully again about the kind of instrument and the kind of process people have to go through to get it. All right, I'm going to go through some of these other pieces really quickly.
Just a quick question.
Yeah.
Given the tediousness, is it generally expected that you would pay survey respondents for network surveys?
If you have it, right? I think it's actually much better to have rapport than it is to have payment. And a lot of times, adolescents are, I mean, it's an awful thing to say, the adolescents are great to give surveys to because they're used to taking tests, right? And they'd rather take your survey than sit through Mr. Moore's class again. And so adolescents tend to be pretty good at their respondents. Open name generators need not be, one of the advantages of collecting data in schools is that if you have the population, I don't have to ask name interpreter questions. Right? I don't have to ask you what Billy's sex is or whatever it is, because I've already sampled Billy and Billy can tell me himself, right? So the Prosper data was remarkably cheap to collect because literally what happened was they were already doing a full census population survey in the school as part of an intervention trial, and they had a blank page on the back of the survey. And so we said, can we have the blank page? We put 7 lines on it. It says, tell us your 7 closest friends, and a little couple checks off for it, and that was the data. That's all it was to it. Of course, then we had to pay graduate students for 3 years to match those handwritten names to a roster, right? So there's a lot of back-end work in doing it. But from a collection standpoint, it was cheap and easy. And so that was the trade-off in that sense. All right, so we're about done. Let's see, any less pieces I want to get to here. All right, a couple of, I've said all of this already, so I'm not going to go over in detail. The main issue is that so how reliable are network data? Someone, where's Jenny? She had to leave. So Jenny was talking about validating network data. There's a fair amount of research on the instability of network data. And this is because a lot of times the questions you ask people, you know, they're tedious, they're long, you're sampling relations that are not necessarily the most set of relations, and so you can be a lot of churn in the data. And that amount of churn is sometimes noise and sometimes signal. Being able to distinguish the two is something you have to do well. There's this whole series of studies that have been done showing that people aren't very good at recalling trivial things, right? And so make sure you're asking them about the things that are important, and make sure that you have their trust if you're asking them something that's sensitive. And so we have work that shows the Project 90 data, for example, are remarkably robust and very high quality data, and that's because John Potteritz spent an inordinate amount of time interviewing these people and getting to know them. The thing about missing data is that when you have missing data, if the true network looks like something like this, but I've not observed some people, or I have no way to know who this person's identity is, this is just a person outside the school, then the person I've sampled, right, I don't know that these two people are not even the same person. I just happen to have a way of knowing. So spend some time thinking about what your boundary specification implies, right? Who are the people outside of the boundary that you can't know anything about? The good news is, and there's a whole series of slides about doing this, is that we've done some investigations into the effects of missing data, at least on the descriptive statistics and inference of those further statistics on networks. And a lot of networks are highly robust to a lot of missing data. And so if your data are missing at random, you can have a fair amount of missing data. Like this would be 70% missing data versus 10% missing data. And in this case, the observed correlation then between the something, I think this is n degree. Yeah, so observed n degree, and the correlation between that and the observed n degree under different regimes of missing data is almost always above 0.7. Right? So something like n degree is remarkably robust to missing data if those data are missing at random. And it's pretty robust if they're missing at bias, if the bias is based on centrality or something. And just, I'm not going to go through this whole paper with you. This is Jeff Smith and I put this paper together. And then John Morgan, John still here? John Morgan and I and Jeff did another paper where we allow you to, to test the robustness along different things. And we came up with this little calculator that if you've collected data and you want to know whether or not your ending scores are biased or not, you can just fill out the various elements of this little calculator, and from it, you get estimates for how biased your different statistics are. And so we think of this as a sort of the equivalent of a power calculator for network missing data. And so if I'm missing 10% and that missingness is highly correlated with centrality, say, then what kind of bias would I expect in this network versus another? So it's all sort of regression and simulation based, but at least it gives you a way of thinking about the extent of missing data. All right. So what to do about missing data? Just do what you can. The easiest thing to do is do nothing, right? So if the error is small, you ignore it, and this is what most of us do most of the time. You can impute ties, and so especially if you're dealing with a relation that has some known constraint, like sex has to be reciprocal. So if A says they have sex with B, then B must have had sex with A, even if B wasn't in your survey, right? So if you have a way of trusting your survey respondents, then you can use that data to look at the response rate. There are new models coming out that are easier for imputing data in the face of missingness using the structural features. And so there's a program out there called AMEN, which is an acronym for something I'm forgetting, but we'll go over that on Thursday. And there are other sort of ways of using the structure of the network to impute missing data. I wouldn't recommend it unless you really need to, but it is possible. All right, so that's a lot, and we didn't get through the end of it as much as I wanted to. But I know people are here to learn R to some degree, so I'm going to stop talking, and we're going to move on to that. Before we do that, questions, thoughts, comments, concerns, just about network stuff, data collection in general, please.
Are there any emerging technologies outside of social networks? Outside of... Sorry.
Just speak loudly, yeah.
Are there any emerging technologies outside of like Facebook and other social network stuff to collect social network data?
Yes. The question is, are there any emerging technologies for collecting network data? A couple of different things. There's some great work being done on Bluetooth networks, so implicit networks, and where I can put a sign on the wall that says we are collecting proximity data through Bluetooth, and I could know that if you're next to somebody else, then I can collect that data unobtrusively. There's a fair amount of work of that sort being done with other kinds of sensors, other kinds of phone tags, these kinds of things, to collect who are you with at a given moment, so sort of equivalence of time event sampling, but on relationships as opposed to people. There's also a great tool called Network Canvas that is being developed for the collection of network data, which we're going to see tomorrow, which is being developed at Northwestern. And it's a new interface for collecting network data that takes most of the tediousness out of that collection. So there is both new techniques for collecting survey data within networks, as well as new ways of collecting observational data that do not require interaction of that way. There's a lot of promise for using facial recognition and other sort of video surveillance pieces. People have done that for years with kids on playgrounds, where we have a very small contained population, and then you can track people, whether they hang out together in the swing set or something. Using it in an open population is a lot harder to do, and people haven't done that as much, but it's possible. People have also been using RID chips on workers on like hospitals and such. So if you and I have been in the room together, that'll show up because we both our RID chip pings the sensor at the same time. So those things are out there. They're still pretty cutting edge, but there's a chance to do it. John Schneider has done some really amazing work using the SIM card of people's phones. So you say, give me your SIM card, and they give it to you, and you can see who they've called or text. Right. Please.
Sort of along those lines, how do you recommend collecting data for networks that change over time?
Yeah, so the question is, how do you collect data for networks that change over time? If the underlying relation is fairly stable, then I recommend collecting waves, and then collect as many waves as you can afford to collect. And so in that case, that minimizes the amount of noise and maximizes the amount of true change you see. If it's something like a Twitter network or other kinds of social interaction network where you really want to know the relationships at a time, then some sort of a third sort of external data, non-invasive data collection technique is best. If it's a relationship where the timing matters for the flow of goods, like sex, so if I care about who has been infected with who, it matters the order of relations, right? So it matters not that you and I just had sex, but that we had sex first and someone else had sex later and someone else had sex later, because the time ordering affects I can only get a disease from my partner's past partners, not their future partners, presumably. And so what that means then is you need to tag the timing of the relation. And usually the easiest way to do that is to ask a series of questions about the last n relations, and then for each relation, ask a start and end date. And then you can get the spell over which that relationship has existed. When was the first time you had sex? When was the last time you had sex? You can do that for communication, right? When was the first time you called this person? When was the last time you called them? And the problem with recall on timing relations is that a lot of social relations have no real end. Right? I can tell you like when I started being friends with my best friend in high school, I haven't talked to Jamie in 20 years. But he's still a good friend, right? And so this notion of when a friendship dies is really hard to know, right? The last time I had sex with this person, that I can know, right? So that's an event. So be clear about the kind, but if you have a sort of soft, fuzzy relationship, when did you stop liking this person? That's a little harder to do, and so you have to be aware of that. Does that help? Please, Nina.
Just curious if you did anything with the Amy Willis, the fake name. Like, did you bias down the number of people they knew, or?
Yeah, we included the number of Amy Willis level rating, how well you claim to know Amy Willis as a control variable and everything else in the model. So essentially it was, and we treated that as a data quality marker.
So what's happening if an ego nominates an alter, and this alter is already an ego in your study?
That's exactly what you want, right? So the question is, what happens when ego nominates alter, but alter is already a person in your study, right? Yeah, that's what you want to have happen if you're trying to do any kind of sociometric data. So then you can measure things like transitivity and reciprocity and other features of the global network we're going to go over tomorrow. It's only a problem if you're assuming that they're not connected, right? So if what I've done is collected, say, a series of sample of ego networks, and it ends up being that one person gets pinged all the time, and I don't know that that person is pinged all the time, and I treat each of these ego networks as if they're independent, when in fact they're linked to the same person, that can create a kind of bias. And that'll happen if you're sampling ego networks from global networks where there are some popular people that you've missed, right? There's a great finding in the network literature, which is your friends all have more friends than you do, right? And so this is a true mathematical fact of the feature that networks have long tails, that there's some people who are very popular. So those very popular people are always in more people's networks than unpopular people, which means that on average, your friends, because your friends are also my friends, they're also Andrew's friends, right? Those people are overrepresented in the data, and so popular people are overrepresented. That's okay if what you're really trying to do is characterize just ego's local context. But if you're worried about something flowing through the network, then there is going to be some bias associated with that connectivity. All right, let's take 5. Jake said 5 minutes. Then we're going to come back and we're going to do introduction to R.